So I have seen a lot of women. They blame themselves. They take all the burden on them because infertility has become a female issue a lot. Always been a female issue.
Yeah, I mean, because if you're not able to have a child, the woman must be at fault.
Exactly.
What is psychological counseling in IVF and what role does it play?
So Simrat, infertility is a very emotional journey. So when it comes to psychological counseling, it means understand the patient, what they are going through, identify their emotions, prepare them for the treatment, and ensure that they have a easy and less difficulty journey during the treatment time.
Hello and welcome to Fertility Tales powered by Nova IVF. I'm your host Simrat, and in this episode, we delve into the crucial role of counseling in fertility treatments, exploring how mental health professionals and fertility specialists can profoundly impact the lives of couples facing infertility. Today, we are honored to have Diana Crasta, the Chief Psychological Counselor at Nova IVF Fertility, join us to share her insights. Welcome to the show, Diana. It's a pleasure to have you with us.
Thank you so much. It's my pleasure to be here.
To start with, how did you get into the field of psychological counseling and what drew you to this? And how did you take up infertility counseling for couples?
So when I look back, the counseling, how did I get into? It was for someone like me who was born and brought up in a very small village of coastal Karnataka, where I did not know anything about psychology or counseling when I was studying. I felt that I can understand people, I can listen people empathetically. That is when I decided that I want to do something different from science and engineering and medical.
Yeah.
And that is when I got an opportunity to interact with the priest who actually guided me to take up a course in Bachelor of Social Work,
Okay.
BSW, from a School of Social Work, Roshanilaya, Mangalore, where I got an opportunity to work with the individuals, children, community, got exposed to people's problems, whether it is a family issues or whether it is psychiatric issues or people from a weaker section. So that is where I developed the interest in counseling. Book of Dale Carnegie was another change in my life where saw things in a very different perspective. And there was my calling, and I decided to take up my post-graduation in Masters in Social Work with a medical and psychiatric specialization.
Oh, that's lovely. Diana, I would like you to also delve on the topic that what is psychological counseling in IVF and what role does it play?
So, Simrat, infertility is a very emotional journey.
Right.
So, when it comes to psychological counseling, it means understand the patient, what they are going through, identify their emotions, prepare them for the treatment, and ensure that they have a easy and less difficulty journey during the treatment time.
What type of couples do come to the clinic? What are their emotional challenges and how do you navigate those?
So we get roughly around 3 categories of patient to the clinic, where the first category is the first timers to IVF who tried for a few years and first time they're visiting the clinic. The second category of people who visited some other clinic and then they would have come to our clinic. The third category of people did some treatment, taken some treatment and had a failed cycle, and then they would have come to our clinic for the treatment.
Okay. So, how do you navigate the counseling for a first timer who's come to the clinic for their treatment?
So, Simrat, what happens when the first timers comes to the clinic? They come up with lot of emotional baggage. They come up with lot of myths and misconception. They go through YouTube or they go through Google. They read lot of things, understand little, and misunderstand a lot. And because of which when they come to the clinic, we have to handle their emotions in terms of giving them the right information.
Right.
And that is the major challenge for the team here. And at the same time, when they come for a counseling, there's a lot of like I have already said, myths and misconception.
Yeah.
Are you using the are you doing the right thing, or are you
Are you
using
doing
my
anything
own?
wrong?
Yes.
And also, I think there's so much emotional baggage that they come with because of the societal pressure and the familial pressure. How do you navigate that?
So we try to understand what is the situation and their family, and where is the pressure coming from. Most of the couples, what we have seen, whenever the minute they know that they are struggling to get pregnant, we have seen them not living with the extended family members, especially in a city like Bangalore or in a metro city.
More cosmopolitan area.
Yeah, they live independently. It's like a more like a nuclear family. We also see that people who come from a rural area, they struggle a lot to deal with their family members. There is a stigma, there is a discrimination, there is a lot of pressure, there is self pressure as well. Sometimes it goes with the blame game. First timers do not know where is the issue or what is the issue. So that also becomes a challenge for the counselors and to the team. Yeah, coming to your second point, how do we take care of this? We will try to understand or listen to them, their problems, what they are going through. Try to understand from their point of view, and then we use different counseling techniques to navigate that. When I say it may be, when counseling it comes, for some people, it's just about creating awareness. They just want information at the right way.
Which is very important coming from a
Yes.
reliable source.
Yes. So, as I said, because of the Google, there is a lot of wrong information that they would have assumed. So, for us, first role is to ensure that they get the right information. So, we have to do awareness counseling. In second stage, what we do, or a second type of counseling, is more of a supportive counseling to this kind of a people. Am I doing the right thing? Is it okay to go to IVF now, or is it okay to visit a fertility consultant now? Should I wait for another 1-2 years to try naturally?
Is it too late?
Yeah, is it too early to go to a doctor? Or so they require that support, that it's okay, you need this counseling. So you need this treatment, and it is okay to take a treatment. It is not your fault, it is very natural. There are so many couples today who are infertile, so they require that support. So we give them that support counseling. There are some couples where we have to talk about the implications. Now, for example, a couple would have advised to go for a donor program, and what is the implications of it? Is it the right thing to do? Am I prepared for it? If I go for it, what will happen? Am I able to accept the child? Will the child will be like me? So then it is required for us to talk about that or counsel them about that, give them the real life examples, ensure that you make them meet somebody who has taken such treatment, and see from them. The fourth category is a therapeutic counseling. Now, this counseling is for those people who are actually gone through a lot in terms of stigma or issues in their family. And, people who, when they go through mental health issues, it is not of 1 or 2 days episodes.
Right.
It is multiple years of issues they are facing. Sometimes counseling may not help. That is when we use certain psychotherapies to handle the patients.
I feel infertility is such a taboo. It's considered such a taboo and a stigma in this world and a country like ours, that the first course of treatment that a person prescribes to themselves is self-blame, and they keep that bottled in. Whereas, to be able to normalize this is so important.
Yes.
To be able to go to the right doctor at the right time,
Yes.
I think, and to come to a psychological counselor to pour your inhibitions out. It's so important for a couple to be able to be on that same page.
Very true, which is actually so true that to help them to understand their problems itself is a difficult.
Yeah.
So I have seen a lot of women, they blame themselves. They take all the burden on them, because infertility has become a female issue a lot, always been a female issue.
Yeah, I mean, because if you're not able to have a child, the woman must be at fault.
Exactly. There was a lady I remember a case where a lady who had come and said, please save my marriage, because if if I don't conceive, in this attempt, then my husband said he will remarry somebody. And this was very emotional for us. It was very difficult as well because IVF may not give you 100% success rate. But the ladies, the issues or the problems, or, the way she came and told her counselor, please do something, let me get pregnant this time. If not, I will, have to, my husband will, abandon me and I have nowhere to go. So these are the situations we actually face sometimes. And there are sometimes we get elderly couple 2-3 times. One is or 2-3 types. One is who have decided to come to a fertility clinic very late, and where you cannot use your own gametes, and then they would like to, the doctor advised them to go for a donor program. That is one. The second category of people who had their children but would have died due to certain
diseases or something, yeah.
we also have couples who have come after their children died because of COVID, come to the clinic and say that, I would like to have a baby. And there are couple who say, I want exactly like my son who died, or exactly like my daughter who died. Now, how do you take care of that? How do you tell them that they are different? Everybody is unique. Your daughter or a son who died are a different people altogether. And this baby is going to be different. So these are the different challenges that we see during the counseling.
You had mentioned a third type of couple who come to you who are probably in their advanced stage and are advised a donor cycle or some other implication. How do you counsel that kind of a couple?
So, as per the ART law, ART Act, the women can get pregnant up to 49, and the men's age is around 55. So, anybody who comes in their late 30s or early 40s for a treatment, usually because of their physical condition, doctor advised them the treatment, which is the donor program. They ask them to go for a third party reproductive program. So during when they've been advised to go for a donor program, that is when there is a challenge, or there is an acceptance issue. Accepting the treatment itself starts with the a couple accepting the treatment, accepting each other, because either a sperm donor or a oocyte donor, acceptance is a challenge in this case. So, starting with that, then the second challenge or a second issue the couple will have is, once they accept, is that, is this child will be like me? Whether the child look like me, behave like me, or does things like me. So there is a struggle between
Acceptance and to be able to come to terms. Yeah.
Yes. And later, the third part is where, what kind of donor am I going to get? Is it the donor with the, how do you select the donor, or what do you, how do we go ahead with the donor? So all of this comes in, third party reproduction counseling. When it comes to psychological counseling, we do talk to them about the importance of donor program at this stage.
Right.
That is first. Then talk about how everybody is different, how everybody is unique, and how it is not right for us to compare ourselves to somebody else.
And apples to oranges, you can't compare them.
Yes.
Right.
And the best example that we give is, if you see twins, do you see twins? Is there any similarities in twins except, if they're identical twins? Their characteristics, their behavior, everything is different. So if you cannot, see similarities in twins, then it is not right to see the similarities also, in your own child, or, if the child was my own, how the child would have been. Because this is a, donor program or a donor child, how the child is different. So it's all about upbringing. It's all about the nurturing. It's all about, yes, it's all about that. So that is where we prepare the couple to accept the donor program, which is advised. Otherwise, there is no way for them to get pregnant because of their advanced age.
When couples come to you for counseling, do you see any and observe any marital issues between them? And if yes, what kind are they?
Oh, yeah. Marital issues are plenty. I think every couple has some issue or the other. Because infertility itself is a couple thing. This starts with the blaming each other, that it is your responsibility, you're the one who, it's you, because of you I'm not able to get pregnant, or because of you I am not able to become a father. So it's all about the blame game. So marital issues are there with many, there are with a lot of couples. I would like to give some examples.
Yes,
There are an example. There was a couple who visited the center with the family members, and the couple was completely prepared. They were completely prepared to become a pregnant. But while counseling, we just observed that wife had some, inhibition. She was not very comfortable. So the counselor called the wife separately, and she wanted to have one-on-one with her, considering that she was not talking much in the counseling. She was not talking much with the doctor as well. During the one-on-one counseling, the women said that I want to become a mother, but not at this stage, because I would like to, rectify my marriage, or I want to, take care of my marriage.
Fix the marriage first before you.
Yes, I don't get so much of attention, or I don't get what I like from my husband. There is a lot of pressure from my family to get pregnant, which I'm okay with it. But before that, I want to, have a better relationship with my husband. So then we also thought, let's have one-on-one with the husband. So when we had a one-on-one with the husband didn't realize that wife is thinking that way.
Yeah.
For husband, I'm giving everything. I am, giving a good life. I'm giving, giving good money.
I'm providing for everything.
Yeah, I'm giving everything what is required for my wife. So I'm a good husband. But because there was a lack of communication, they were not able to express what they feel for each other. And during the counseling session, it was actually understood that what is the expectation from a wife and what is the expectations from a husband. And then there was a combined session where we identified what was required to be done and helped the couple to identify by themselves what is good for each other. And after a few months, the wife called us. And during this time, we continued the treatment as well, because, the wife was ready to go ahead with the treatment because things were getting better at that point of time. And then wife called to say that, yesterday was my birthday and my husband got a cake for me. And, this all happened because we were able to communicate each other and you helped us doing this. So this is one of the example where small issues, but,
But there's a lack of communication between the couple and they are not able to express that to each other. And that's why I feel counseling plays such an important part in bridging that gap.
Nova is focusing on the parenthood, but also at the cost of having the better relationship between the husband and wife.
Sometimes couples think that after having a child, they can save their marriage if they are anyway having some marital problems. But once you have a child, I think things will fall into place. Do you get such cases? And how do you deal with those people who are trying to fix something which is broken and,
So we do get, actually, and fixing a marriage because of the child, I feel it is a myth. Because if you have to fix your marriage, if you have to fix a marriage between the husband and wife, child will be a additional responsibility. And to take care of your additional responsibility, husband and wife should have a mutual understanding, compatibility, and that mindset to help each other. So I can give an example where before this lady got pregnant, everything was very good. Family was very supportive. They were not stigmatizing or discriminating the woman. The family was very supportive. Husband was very supportive. Everything was going so well. She got pregnant. Family was so happy about it. The problem started when she got pregnant or after her pregnancy. Because here she felt that, this is a precious child. I need to behave in a certain way. I need certain things in a certain ways. And for a husband and for a family, this became too much. That no, pregnancy is natural. Even though you conceived through IVF, it is natural. You can do a lot of things. And there the problem started between husband and wife. And when actually came to see us in the clinic, that is when doctor realized that husband and wife, there is something is going wrong, because after pregnancy they get to see come to see the doctor. And then the doctor called the counselor and said that, I want you to work on the couple, because I see that there is a issue. Again, as a couple counseling methodology, we spoke to the wife first, we spoke to the husband later, had a one-on-one with each other, with separately with them, and then we had a combined session, and then we helped them to, identify the issues, expectations from each other, and then they are going well now. I'm sure, I guess she would have delivered now, not very sure, but this was one of the recent cases that we have seen.
I mean, so then I think working on your relationship is the most important part before you bring a child into this world.
Yes, very, very important.
Infertility is such a sensitive subject to any person. Sometimes the blame is on oneself and they don't know how to deal with it or navigate it. That might lead to, severe depression. So how do you deal with people who come with this mental block or this depression?
So, a lot of couple who visit us, will have a depression or will have issues because of their, infertility. So, when couple come to us, we see what is their stages of depression, whether it is mild, moderate, or severe. Mild, moderate can be taken care with the counseling or with the help of psychotherapy. Like we do, CBT, which is therapy which helps the people to take care of themselves. During the severe depression or a severe depression cases where we require to stop the treatment because we believe this requires additional support, counseling or a therapy doesn't help in this case. These people require to see a psychiatrist and take a treatment, get better and come back. We have seen couple having suicidal ideations because of infertility, and there are couple who have been tried also to commit suicide. So as a policy at Nova, we look into the well-being of a couple, and if the couple is healthy mentally and physically, they can always come back for a treatment on IVF, because they treatment is available anytime. But your severe depression requires to take care at the right time.
All right. And do you collaborate with any other health practitioners to be able to give you a clearance to resume the treatment? Is there an arrangement like that?
Yes. So we do recommend them to go to a psychiatrist. So the fertility doctors refer them to a psychiatrist known to them, or any hospitals which has a psychiatric setup. They can go and take care of them and take treatment and then come back. We also ask them to get a letter from the psychiatric saying that this person is mentally fit to start the IVF treatment.
All right. Diana, as you said, infertility is a couple's disease, and there's an interesting gender dynamic there. Who do you think is more likely to seek counseling, and how does the counseling differ between men and women?
Yeah, that's an interesting question. Who seek counseling during infertility treatment? It is always women.
Of course.
So they are the first one to, come to us or, seek help, even though we would like the men to come, not that they don't want to take a counseling. But there is a resistance, of course. Even there is a need for counseling for men. He's always puts his wife across first and says, first you do the counseling to my wife. She thinks a lot. She is more depressed. She is more worried always. And, so you counsel her first. So seeking counseling from a men's side is little different. Compared to the last few years from, being at Nova, I see now men coming forward, but not as much as women come forward to take counseling.
How does the approach differ? And also an extension to that question, how has the attitude towards psychological counseling, has it changed for people?
It has changed for sure. There is more awareness about mental health. There is more awareness about psychological counseling, thanks to some of the celebrities who come forward and spoke about their concerns or issues on mental health, which helped a lot of people to go back and seek a treatment or seek counseling help as well. COVID has helped us over the last over the last few years now. Due to COVID, there was a death, there was a grief counseling which was required, and the need for psychological counseling or a mental health has changed drastically after COVID, and now it is still a taboo in some places, but not so much how it used to be before. We still get to hear people saying that, why should I go for a psychological counselor, I'm not a
As
man.
if it's a taboo and it's not, self-work and there's something wrong with you. People do come with that attitude of denial where they don't want to accept that maybe, having a mental health is as important as having your physical health.
Exactly. So we also want to make it so normal that when you are not well, you go to a doctor.
Yeah.
That is a physical health as concerned. But when you are mentally not well, it is okay to go to a doctor, or it is okay to go to a counselor. It is not need to go to a doctor. Go to a person who actually, where you can speak openly. I always believed that you have lot of issues. Either you write down or you talk to someone.
Yeah.
It will help you to take care of your own self, and that really worked in my case. And this is something I also tell a lot of people as well. If you're not so comfortable to talk, start writing.
Start journaling. Journaling really helps.
It really helps.
And I think you're dealing with a two-pronged approach to two big problems. First is normalizing infertility and also normalizing the acceptance for mental health, and to be able to, that must be really challenging for couples to understand and come across.
It is very, very true. Accepting the IVF treatment for some couple is so challenging, and accepting psychological counseling or mental health importance of it is also challenging for some couple. The couple who comes to any fertility clinic, they require two things: a right doctor to take care of their infertility issues and advise what is right to them, and a right mentality to take care of myself before I start my IVF journey.
Diana, as a infertility counselor, how do you keep abreast with all the updates, and how do you keep the couples informed with the latest medical, legal knowledge, and how do you keep yourself on your toes in this field?
Yeah, so psychology field is such a field where you have to keep on upgrading yourself. Nova has around 72 centers across India, and we have psychological counselors in all our centers. So one thing that we do is exchange our learnings. We do cross learnings, we share our case studies, we discuss the difficult case studies with each other, and discuss different scenarios or different state issues, different culture, or how the counselor faced faced this couple, how did she help them to come out of this issue. So we do a lot of learnings and lot of cross learnings with the team. So that is where it really helps us. And secondly, as a psychological counselors, we also have to read a lot about different counseling sessions that others do. We read a lot, or we listen to a lot of podcasts, or listen to a lot of things which helps us to upgrade ourselves in counseling.
Okay, and I feel mind is such a beautiful thing, and it keeps changing, and everybody is so unique that you might have so many cases from across the country with, you said 70 centers, which would, give you a chance to understand so many cases. And no case might be the same, but it might just help you counsel somebody else.
Yes. And one funda is that practice. The more you practice, more you counsel people, you will get better.
And also so many cases you will be able to understand that if I were to counsel this kind of a person because they're going through, it just helps.
There is no particular rule that you need to counsel a patient in a particular way.
Right.
So there are different ways for as each person is unique. We just need to remember my counseling principles, my counseling techniques. That's it. And then I just have to customize, or I have to use as per the patient or the couple that comes in front of me. So that is the only thing.
Nova is present across the country, 45 cities and 70 centers. How do you make sure that the same quality of counseling is delivered across the centers?
Yeah. So we do recruit psychological counselors who are postgraduate in psychology with the different streams, whether it is masters in social work in psychiatric specialization, or it is MA psychology, MSc psychology, or a clinical psychology. We recruit only postgraduates in psychology at the first place. Second place, we have a very good training mechanism where we train our people on infertility and infertility counseling. So we ensure that every person who has joined with Nova as the psychological counselors goes through this rigorous minimum of 1 month of training uh, at the center, or maybe in other center in the presence of a senior psychological counselor. In some cases, we also provide mentorship service as well, so that the counselor gets prepared and takes care of the counseling, quality counseling.
All right, and the same standard is then extended to all the centers.
Yes. Sometimes we also discuss, as I've mentioned earlier, that we do these cross learnings.
Yeah.
And this cross learnings really helps them to learn from each other, the therapies they would have used, how they would have used, and what are the challenges they faced, what kind of different patients they see. So all of this really helps them to learn from each other.
Diana, for someone who's looking at a career in psychological counseling, how should they go about it? What would be your 2 bits?
Anybody who would like to take up psychology as a career, there are a lot of opportunities. There are a lot of universities who provide the course. So anybody who would like to take up, they need to start with a graduation. Any graduation, 3 years graduation is good enough for someone to, take a specialized post-graduation course in counseling.
They can be a graduate in any field?
They can graduate in any field. So for someone like I did my master's in social work, specialized in medical and psychiatric social work. So there are colleges in Mangalore, that college that I studied, School of Social Work, Roshanilaya. There is similar courses available in TIS. There is a similar courses available in Bombay with Nirmal Niketan.
Okay.
And there are other colleges. In Chennai, there is MSSW, which is Madras School of Social Work. They also provide MSW as a course. Apart from this, there are colleges who provide MA in counseling, MSc in counseling, or MA psychology, or a clinical psychology. There are again the colleges like in all of these colleges where MSW is part of it. All those colleges also provide postgraduate in psychology. Doing a post graduation is a very good thing because you will be considered as a professional and give a lot of other therapy exposure and practical experiences to do things when you are studying. So these are the best career options. And there are a lot of, and in the ART Act, counseling is mandatory. Mental health is mandatory to take care of the couple. So there is a lot of opportunities for people to take up
this up as a career
for them as well.
That's great. I'm sure people who are listening to this podcast will definitely benefit from this information.
I hope that is helping them to decide on their career if they are thinking of psychology.
Thank you so much, Diana, for spending this time empowering us with this knowledge and also bringing this important topic to life about psychological counseling in infertility for couples, because I feel this is such an important topic but often not talked about, infertility and mental health in itself. So thank you so much for empowering us with this insightful session. It's been a pleasure to have you with us.
Same here, my pleasure to share my thoughts. Thank you so much.
To our listeners, thank you so much for tuning in. This is Fertility Tales powered by Nova IVF. I'm your host Simrat, and I hope you cherished this episode and took a lot from it. Till next time, take care. Don't forget to like, share and subscribe. Thank you.